Hi, good morning. It's Marika here from Skin Essentials. I hope you're all having a lovely morning. I certainly am. It's lovely out there today. It was nice on the way into work. I was just getting ready here for my first treatments of the day, and I thought I'd share with you something that I've been doing for myself, but I also have been sharing with clients, and you'll see that this is a magnetic therapy. Something, because you're all very lovely and thoughtful, and something that people ask me quite a bit is, do my hands not get sore? Do my hands not get painful and tired from? I do an awful lot of hands-on work. I do love the facial lifting and sculpting. So very thoughtfully, a lot of you do ask me, do my hands not get sore and tired? And yes, sometimes they do. So, but not for long. Like 5 minutes later, I'm ready to go again with the next treatment. So one of the things that I do to keep my hands right, I'm going to share with you now because it's magnetic therapy. And I didn't actually begin using this for my hands. It just was, I realized that it was a mirror. I should have known, of course, from reflex therapy, there's mirrors all over the body. So far worse than getting sore hands from doing treatment after treatment is actually my hip. My right hip, for me, tends to get at me from sitting in one position so much all day. So I started using magnetic therapy for my hip, but you can't do that. You can't do facial reflexology on yourself. This is something that I use as part of a facial reflexology treatment or foot reflexology if it's appropriate. And indeed you can add it on to any facial treatment as a pain management, but I will talk about that kind of separately. This is just quickly to show you how it works. So to do a facial reflexology takes an hour, so that's kind of hard. That definitely would pull the arms out. You're trying to do it on yourself and keeping your arms up. So hand reflexology is what we would do for ourselves because you can get at them much better. So for hip, and in my case for my right hip, you would be around about here would be where the spinal nerve that serves the hip is. That's what we're working on with neuroreflexology. It's the nerve that passes through that hip. So right here, it's a little bit sore, right here for me is where that is. And I say for me because sometimes people will say to me, well, show me a point for this, that or the other. They do vary, of course. Our faces are different shapes, our bodies are different shapes. If your hip is a little bit out of line, that might be slightly to the left or right of where you'd see it on a diagram. So for me, this is where that spinal nerve is pinched. And this is what happens with a lot of pain. It's because the spinal nerve gets pinched, and even a slight bit of muscle tension is enough to cause that disruption in the nerve and to cause pain. And then it can, because that nerve runs all around the place, it can cause pain in various places, so including your hand. So this is where for me I will use the magnetic therapy, my NeuroPen, on that point there. So I started doing that for my hip, and using that for about 30 seconds is enough to really quickly help with the pain in the moment. Now, of course, if you're suffering from a chronic pain, you want to have a course of treatments. 30 seconds is not going to help. It's going to help in the moment. So using this on my wrist here, as you see, for my hip, suddenly, and I didn't even realize that I had this stiffness in this hand, more so than I'm right-handed anyway, and that has really given me more range of movement, which is great, of course, for my treatments. So just a little insight into neuromagnetic therapy, using this for the nerve paths. So this is something, if you have facial or foot reflexology, any reflexology with me, you might be familiar with me using on pain points around the face or feet. But we can use it for lots of other things as well. But yes, just to answer your question, do my hands get sore? And thank you for asking. No, because I keep them right with various things, but mostly with my magnetic therapy. So if you want to know any more about magnetic therapy or working with yourself, just give me a call, leave a message. You know all of that. All of the contacts are all around. And do continue on and have a lovely day, and I will talk to you really soon. Thanks for watching. Bye.